Hello, my name is KSandoval, and my presentation today is on social determinants of health and social ecological model, SEM, in regards to homeless youth in the United States. I'll start off with social determinants of health. At the core of what people experience as health and well-being, we see circumstances shaping outcomes such as economic stability, neighborhood and physical environment, education, community and social context, and healthcare systems. The social economic model, SEM, considers the complex interconnections between individual, relationship, community, and societal factors to aid our understanding of how social influences impact health. Through the socioeconomic model, we recognize points at which intervention can modify health outcomes, in this presentation specific to homeless youth. At the core of the socioeconomic model, we see individual and the intrapersonal level. Homeless youth is defined as young adults and adolescents aged 12 to 24 years old who are an at-risk population. Homeless youth are unhoused or don't have stable dwellings and most likely live on the streets, shelters, or unstable situations, according to Stewart and Townley, 2018. Unhoused and unsheltered youth may also reside in transitional settings, including awaiting foster care or temporarily in hotels or motels. Some of the risk factors found within this first layer is unaccompanied youth, higher rates of trauma and violence, mental health, gender identity, illness, self-esteem, optimism or the lack of housing, and substance abuse. Some of the trends that I found associated within this first intrapersonal level were that 2.5 million children are homeless in the United States, according to Facts and Statistics 2022. Youth who identified as LGBTQ+ were 4% to 13% more likely to be homeless than heterosexual youth, according to Stewart and Townley, 2018. And the last was 48 to 98% of homeless youth met criteria for psychiatric disorders, according to the same Stewart and Townley 2018 article. Some of the patterns that exist are economic and structural barriers. Homeless youth lack education or skills. They are negatively affected in school performance and outcomes, and there are higher rates of mortality by suicide or overdose. High risk of malnutrition also exists, and high risk of preventable infectious diseases, according to Glutenkin et al. 2020. Five facts about homeless youth. Approximately 80% of homeless youth ages 12 to 21 use drugs or alcohol to self-medicate to deal with trauma and/or abuse. Approximately 40% of homeless youth identify as LGBTQ+. Family rejection on the basis of gender identity or sexual orientation was the most frequently cited factor. In 2022, there was a report on sexual abuse amongst runaways, and they found that 21 to 40% of homeless youth have been sexually abused, according to the US Department of Health and Human Services. And the last fact that I cited is that 41% of youth who run away have actually been abandoned by their parents. And this information I found on the website dosomething.org. that listed 11 facts about homeless teens. In the next layer, we see the interpersonal microsystem. Homeless youth have daily interactions with their interpersonal level. Some of the risk factors that I found within this level included lack of social support from family and friends, lack of family cohesion, most family conflict, domestic violence or dysfunction within the family, child abuse or neglect, family mental health, small to no networks, poverty, low income or unemployed parents. And some of the trends included family therapy focused on family preservation. And this is by stimulating support, instability, substance abuse, anger, grief, or trauma can actually address both intrapersonal and interpersonal risk factors, according to Wang et al. 2019. Some of the patterns that I saw within this interpersonal level was that homelessness has been associated with low social capital. Quality and quantity of social relationships and networks can either positively or negatively affect a person. Therapy addressing depression and family therapy or substance abuse are all promising interventions, according to Wang et al. 2019. In the third ring, the organizational or mesosystem layer, we see homeless youth and their interactions with institutions, organizations, agencies, and community networks. Some of the risk factors that I found within these organizational and mesosystem were the inequitable systems, lack social services, care avoidance by the homeless youth part, transitioning between the juvenile systems, and inadequate access to health. Some of the trends of people that I found homeless youth to interact with through social support were case managers, social workers, school counselors, and through the shelter system, there are coordinators and those who do the intakes for the shelters. At the foster care level, we see foster parents, case managers, and social workers. And within the juvenile system, we see probation officers and social workers. Within the medical systems, there are the nurses and healthcare providers, therapists, and counselors, as well as wraparound reps or navigators. Some of the patterns that I saw within this system were that schools and healthcare facilities require numerous documentation and multi-step processes that are frequently creating barriers for homeless youth to access, according to Gallardo et al. 2020. Limited availability of free and low-cost services, and the interagency relationship, which helps simplify the referral process and provides straight organizational contacts. For example, a wraparound services representative or a navigator. In the next ring, which we see the community and exosystem, we see how the social contextual factors affect homeless youth. Some of the risk factors in this layer are the gaps between foster homes, long waits for foster care intake, the overcrowding of shelter systems or not enough drop-in centers, discriminatory juvenile systems, lack of affordable housing, inadequate health and access resource, and then the lack of transportation, which I found through an article by Davidson et al. 2016. Some of the trends that I found were that sense of community through, some of the trends that I found were that homeless youth found a sense of community through shelters. The social network was built through the people that they found in the same congregating areas, such as the parks, shelters, or food pantries. Oftentimes, they feel a sense of community within the foster home. And then also some cited organizations such as nonprofits or churches were amongst those community level places that homeless youth tend to reach out to. The patterns within this level included network size, even though homeless youth are congregating with other homeless youth or other homeless individuals, their actual network size is very limited. There is a diminished social outcome. So even though they may experience or they may be around others, their social outcome is pretty low because they're not very social. By enhancing structural support such as income and housing, we are able to address some of the risk factors within this community layer, and then also increasing housing support and drop-in centers, according to Wang et al. 2019. In the last outermost layer, we have the public policy influencing homeless youth at the macro system level. And we see how public policy shape and contribute to negatively or positively homeless youth. Some of the risk factors that I found for public policy on homeless youth were the resource eligibilities and the laws and regulations, federally funded programs, organization resources and support, a lot of policy barriers, stakeholder engagement was one of the risk factors that I saw, although it wasn't, it was on the brink of being a risk factor. There's a lot of stakeholder engagement. So the way that I saw this as a risk factor was if the stakeholder engagement stopped, for example, nonprofits pulling out from doing things such as food pantries or whatnot, there could be an adverse effect on homeless youth. Racial discrimination and prejudice in governing bodies, such as the judicial system that harshly condemn Black and Brown youth, is also a risk factor. And some of the trends included housing shortages and unregulated rising rent costs as one of the threats in increasing homelessness overall. Congress-led support. There is currently a $32.1 billion bill in funding for tenant rental assistance for low-income and vulnerable individuals like youth. And this is according to the National Alliance to End Homelessness. So this is a Congress-led bill that would support this funding for the tenant rental assistance program. And then additionally, a $3.6 billion in funding for the U.S. Department of Housing and Urban Development's homeless assistance grants. And this is also according to the National Alliance to End Homelessness. All of these, both of these bills are being proposed by, have been proposed by Congress and would aid in some way to end or address some of the risk factors associated with homelessness. And then lastly, I found programs that, like the McKinney-Vento Homeless Assistance Act, that ensures that educational rights and protections of children and youth experience homelessness are preserved. So, this ensures that children who are experiencing homelessness through the McKinney-Vento Act, they are also getting access to be able to enroll without all of the needed documentation. They have access to free meals, free public education, free public transportation to get to and from school, and then supplies as well. So backpacks, notebooks, crayons, all of the needed supplies that a student who may be experiencing homelessness might not have access to. And then grants through grants through the American Rescue Plan for homeless children and youth helped state educational agencies and local agencies with wraparound services. This was according to the U.S. Department of Education. And the wraparound services is intended to be like a one-stop shop for homeless youth, where they can get medical, resources, educational, but also case management support, foster care, referral, a social worker, get connected to a social worker that could actually oversee their case. In conclusion, homeless youth, I found, is interconnected in all aspects of the socioeconomic model with various social determinants. And this is what's making this complex issue very difficult to address. And there is not only just one intervention. What was also found through this was the immediate need to provide mobile wraparound services to identified homeless youth, and then additionally establish a measure for community, local community people such as school counselors, teachers, neighbors, to be able to identify signs when a teen or an adolescent is either already experiencing homelessness or might be on the brinks of being homeless, and actually be able to connect them to resources such as shelters, medical services, case managers, school officials, other nonprofit organizations, food pantries, and such. And then lastly, and equally as important, was the need to help youth who are dealing with trauma or sexual abuse or rejection from their family for their gender identity and sexual orientation. And, the way that you could prevent kids from running away or becoming homeless is actually addressing the abuse, rejection, or trauma through therapy. And I think at the core, that might be also a way to help prevent some of these children and youth and adolescents from becoming homeless. So that concludes my presentation. Here I have a slide for questions and answers. And then last slide, I have included the resources. Thank you very much.